These moves look effective, but they're wrecking your joints over time. Are your workouts secretly damaging your joints? Many people unknowingly perform exercises that cause long-term joint pain and inflammation, even if they're trying to get healthier. In this video, we'll uncover the most common exercises that put your joints at risk, especially your knees, shoulders, and lower back. You'll learn why these movements are harmful, what to do instead, and how to modify your workouts to stay fit without pain. Welcome, fitness enthusiasts. Today, we're diving into a critical topic that underpins every successful and sustainable fitness journey: safeguarding your joints. Our goal is to equip you with the knowledge to identify and avoid exercises that could inadvertently compromise your long-term joint health. This isn't about fear-mongering or limiting your potential. Instead, it's about empowering you to make informed choices, ensuring your body remains resilient and capable for years to come. We'll explore common pitfalls and offer actionable strategies to protect these vital structures. While we won't be listing specific exercises here, the principles we discuss will allow you to critically evaluate any movement. Understanding these foundational concepts is the prerequisite for making intelligent exercise decisions. To begin, let's identify the common characteristics shared by exercises that pose a higher risk to joint integrity. Through careful analysis, we can discern recurring themes that often lead to undue stress and potential injury. Recognizing these patterns is the first step toward proactive joint protection. One primary theme involves exercises that demand an excessive range of motion. Pushing a joint beyond its natural healthy limits, especially under load, can strain ligaments, tendons, and cartilage. This often occurs when attempting to achieve a depth or extension that your individual anatomy or current flexibility doesn't safely allow. Another significant characteristic is high impact forces. Activities that involve repeated, forceful landings or sudden jarring movements can transmit considerable stress through your joints. While some impact is beneficial for bone density, excessive or uncontrolled impact can accelerate wear and tear on cartilage and other soft tissues. Perhaps the most pervasive and dangerous theme is the frequent performance of exercises with improper form. Even movements that are inherently safe can become hazardous when executed incorrectly. Poor technique often shifts stress away from the intended muscles and onto vulnerable joint structures, leading to compensatory patterns and eventual injury. Finally, we must consider exercises that place repetitive, undue stress on joints. This isn't always about a single high-impact event, but rather the cumulative effect of countless repetitions. Without adequate recovery, proper mechanics, or sufficient muscular support, this chronic stress can lead to overuse injuries and degenerative changes over time. Understanding these themes is crucial because they directly contribute to the general mechanism of joint damage. When joints are repeatedly subjected to excessive range of motion, high impact, improper loading, or chronic stress, the delicate balance of their structure and function is disrupted. This can initiate a cascade of microtraumas that, if left unaddressed, lead to more significant issues. Let's consider the specific joints most frequently affected by these types of exercises. The knees are particularly vulnerable, often experiencing issues like patellofemoral joint pain due to poor tracking or meniscal tears from twisting under load. The complex structure of the knee makes it susceptible to forces from both above and below. The hips, too, are at risk, with concerns such as labral tears from deep flexion or impingement syndromes. The ball and socket joint of the hip requires a balance of mobility and stability, and exercises that compromise this balance can lead to significant discomfort and damage. Shoulders are another common site for injury, often manifesting as rotator cuff tears or impingement. Overhead movements, especially with poor scapular control or excessive weight, can pinch tendons and bursae, leading to inflammation and eventual tearing. The shoulder's incredible mobility also makes it inherently less stable. The spine and back are also highly susceptible, with risks including disc herniation from excessive flexion or rotation under load, and facet joint irritation. The intricate network of vertebrae, discs, and ligaments in the spine demands careful attention to form and loading to prevent injury. Other joints, such as the wrists and ankles, can also suffer. Wrists might develop tendinitis from repetitive gripping or weight bearing in compromised positions, while ankles are prone to sprains from instability or high-impact landings. Every joint in the body has its unique vulnerabilities. These mechanisms and affected joints can lead to a variety of specific injuries. Cartilage damage is a significant concern, ranging from gradual wear and tear to acute tears. Once cartilage is damaged, its ability to repair itself is limited, often leading to chronic pain and reduced mobility. Ligament strains or tears, such as those affecting the ACL or MCL in the knee, can result from sudden twisting or hyperextension. Ligaments provide crucial stability, and their compromise can lead to joint instability and further injury. Recovery from ligament damage can be lengthy and challenging. Tendinitis, or more accurately, tendinopathy, involves inflammation or degeneration of tendons. This often arises from repetitive stress without adequate recovery, leading to pain and weakness in the affected area. Common examples include patellar tendinopathy or Achilles tendinopathy. Bursitis, the inflammation of bursae, which are fluid-filled sacs that cushion joints, can also occur. This is typically caused by repetitive friction or direct pressure on a joint, leading to localized pain and swelling. Common sites include the shoulder, hip, and knee. Perhaps one of the most concerning long-term consequences is the accelerated development of osteoarthritis. Repeated microtrauma, acute injuries, and chronic stress can all contribute to the breakdown of joint cartilage, leading to the pain, stiffness, and reduced function characteristic of osteoarthritis. Finally, impingement syndromes, where soft tissues are compressed between bones, are common in joints like the shoulder and hip. This pinching can cause pain, inflammation, and limit range of motion, often requiring careful modification of movement patterns. The good news is that many exercises can be modified to reduce joint stress without sacrificing their effectiveness. The core principle of modification is to adapt movements to your body's current capabilities and limitations. This ensures you can continue to train effectively and safely. Several techniques can be employed for modification. Reducing the range of motion is often a simple yet effective strategy. For instance, performing squats to a depth that maintains neutral spine and knee alignment, rather than pushing into excessive flexion, can protect the knees and hips. Lowering impact is another crucial technique. This might involve switching surfaces, such as running on a track or grass instead of concrete, or opting for lower impact exercise types altogether. Activities like swimming, cycling, or using an elliptical machine can provide excellent cardiovascular benefits with minimal joint stress. Adjusting resistance or load is also vital. Sometimes simply reducing the weight or resistance used allows for better form and reduces the compressive forces on joints. Prioritizing proper movement patterns over lifting heavy is always the safer and more effective long-term strategy. Consider these alternative exercises that achieve similar fitness goals with less joint risk. For strength training, machine-based exercises can offer more controlled movement patterns and support compared to some free weight exercises, especially for beginners or those with joint sensitivities. Body weight exercises, when performed correctly, are also excellent for building strength without external load. In cardiovascular training, swimming and cycling are fantastic alternatives to high-impact activities like running or plyometrics. They provide excellent aerobic conditioning while being incredibly joint-friendly. Even brisk walking can be a powerful low-impact cardio option. For flexibility and mobility, gentle, controlled stretching and dynamic warm-ups are preferable to ballistic stretching, which can place sudden excessive strain on joints and connective tissues. Yoga and Pilates are also excellent for improving flexibility, strength, and body awareness in a joint-friendly manner. Beyond modifications, emphasizing the importance of proper form is paramount. Correct technique is your primary defense against injury and the most critical factor in ensuring exercises are effective and safe. It dictates how forces are distributed across your body. The consequences of poor form are severe and far-reaching. Incorrect execution exacerbates risks by placing undue stress on vulnerable structures, leading to compensatory movements and muscle imbalances. This can create a vicious cycle of pain and dysfunction. Learning proper form requires dedication and attention. Seeking guidance from qualified professionals, such as certified personal trainers or physical therapists, is invaluable. They can provide personalized feedback and correct your technique in real time. Utilizing educational resources, including reputable videos and articles, can also significantly enhance your understanding of proper mechanics. However, always cross-reference information and prioritize sources from certified experts. Focus on controlled movements over speed or excessive weight. Mastering the movement pattern with lighter loads or body weight should always precede adding significant resistance. It's also essential to mention the need for individual assessment. What works for one person may not be suitable for another, even if they share similar fitness goals. Individual variability in anatomy, biomechanics, and injury history means that exercise suitability differs significantly per person. Pre-existing conditions, such as prior injuries, chronic pain, or specific health issues, must always be considered. These factors profoundly influence exercise choices and may necessitate specific modifications or complete avoidance of certain movements. Ignoring them is a recipe for re-injury or exacerbating existing problems. Professional consultation is highly recommended for anyone with concerns about joint health or pre-existing conditions. Healthcare professionals, including doctors or physical therapists, can provide medical clearance, diagnose issues, and offer rehabilitation strategies. Their expertise is invaluable for safe exercise progression. Additionally, seeking guidance from certified trainers who understand joint mechanics and injury prevention is crucial. They can help design personalized plans that account for your individual needs, goals, and limitations. A tailored exercise program is far more effective and safer than a generic one. In summary, protecting your joints is not merely an option. It's a fundamental requirement for a long and active life. We've explored how excessive range of motion, high impact, improper form, and repetitive stress contribute to joint damage. We've also highlighted the specific joints and types of injuries commonly affected. Remember, the goal is not to avoid exercise, but to make informed choices. By understanding the principles of modification, embracing safer alternatives, and prioritizing proper form, you empower yourself to train effectively and sustainably. We encourage you to make informed exercise choices, always listening to your body and seeking professional guidance when needed. Your long-term health and ability to enjoy physical activity depend on the proactive care you give your joints today. Invest in your joint health, and you invest in a lifetime of movement. If you want to train smarter, move pain-free, and protect your joints for years to come, hit like, drop your toughest joint issue in the comments, and subscribe for more health and fitness insights. Thank you for watching.